Welcome to Retreat You Podcast. This is the Deep Dive, and today we are tackling a really critical area of health. It's something often just, pushed aside into a quick morning and night routine. We're talking about the connection, the really profound biological link between your gum health and, well, your entire body's well-being. Our mission today is basically to give you a shortcut, a way to get properly informed without wading through tons of dense material. We've gone through quite a stack of sources, academic reviews on nutrition, vitamins, minerals, clinical guides from places like Dalhousie University on oral conditions, and some pretty sobering public health stats on just how common gum disease is. We're doing this deep dive because, frankly, we need to get beyond just brush your teeth. We need to really understand how serious chronic gum disease can be, and importantly, find some real evidence-based steps you can take.
Steps that go beyond just brushing.
Exactly. Things like supplements, maybe different daily routines, things that actively support your systemic health.
Yeah. And the scope here is huge, really. We're not just talking about, bad breath or avoiding cavities. We're exploring the idea of the mouth as a kind of gateway, maybe even a source, for chronic low-grade inflammation throughout the body. The sources are pretty clear on this. What starts in the gums, it doesn't just stay there. It can influence your risk for heart disease, type 2 diabetes, lung issues, even cognitive problems down the line.
Wow.
So, yeah, we need to start by really defining what we're up against, this whole spectrum of periodontal disease. Then we can look at the strategies, the defenses, both mechanical cleaning stuff and the nutritional support.
Okay, let's unpack that first part then. Establish the basics. People often just say gum disease, but you're saying it's more of a progression. Like stages.
Exactly. It's a continuum. It really starts with something pretty manageable, something almost everyone experiences at some point.
Gingivitis.
Gingivitis, right. Yeah. That's the early stage. It's basically inflammation of the gums, and it's caused directly by plaque building up along the gum line. And it is incredibly common. The data suggests something like, 90% of people get it at some point?
90%. That's almost everybody. So we're talking the classic signs. Red gums, maybe a bit puffy or swollen, bleeding easily when you brush or floss.
That's it. It's your immune system basically reacting to that local buildup of bacteria. A first alarm bell.
And the crucial thing here, the really important point you made earlier,
is that gingivitis can be completely reversed.
Right. Reversible.
Absolutely.
Yeah.
If you really commit to good daily oral hygiene, proper brushing, getting between the teeth with floss or other tools, you can clear out that plaque, reduce the irritation, and get the gums back to being healthy, firm, pink, not bleeding.
So it's a warning sign we really shouldn't ignore.
Definitely not. Because if you do ignore it, if that bacterial irritation just keeps going, that's when you slide into the next, much more serious stage, periodontitis.
And this is where the real damage starts, the systemic risk connection.
This is it. Periodontitis isn't just inflammation anymore. It's chronic inflammatory disease. It goes deeper than the surface gum tissue. It actually leads to the breakdown of the structures that hold your teeth in place. We're talking about destroying the ligaments that connect the tooth root to the bone and, critically, loss of the actual jawbone, the alveolar bone.
That sounds significant.
Yeah.
And how common is that stage?
It's alarmingly common, especially as people get older. Some sources say around 75% of adults over 35 show some signs of periodontal disease. Globally, estimates range, but often between 20 and 50% of the population has it to some degree.
And that destruction, the bone loss, the ligament damage, that's the part that, unlike gingivitis, you can't just reverse with better brushing.
That's the absolute key takeaway. Advanced periodontitis, the destruction it causes, is irreversible.
So you can't grow back the bone.
No. Professional treatment, like deep cleanings and really excellent home care, can stop it from getting worse, manage the infection that's left, but the bone and ligament tissue that's gone, it's gone for good.
Which makes prevention just absolutely paramount.
Non-negotiable.
Besides just not cleaning well enough, what else pushes someone from gingivitis toward periodontitis? Were there major risk factors?
Poor hygiene is the foundation, definitely. But yes, several things really accelerate it. Smoking is a huge one. Heavy smokers can be 3 times more likely to get severe periodontitis.
3 times? Wow.
Yeah.
Oh.
Then there's genetics. Some people are just more susceptible. Age is a factor. And certain health conditions play a big role, especially type 2 diabetes. It messes with your body's ability to fight infection and repair tissues generally, including in the gums.
Okay, so let's pivot to that core theme, the periosystemic link. Why should someone listening care about losing a bit of bone in their jaw when they're thinking about their heart or their blood sugar? It still feels like just a dental problem to many people.
It's a fair question, but the mechanism is what's fascinating and, frankly, a bit scary. Think about inflamed, bleeding gums and periodontitis. That surface area, if you added it all up, can be like the palm of your hand.
That much.
Yeah, a significant surface area that's essentially an open wound, constantly teeming with harmful bacteria. This allows not just the bacteria themselves, but also the inflammatory chemicals they trigger to get directly into your bloodstream.
Ah, okay. So it's like a constant leak of infection and inflammation into the whole system.
Exactly. It becomes systemic, and that's the direct link to these major chronic diseases.
Let's start with the big one. Cardiovascular disease, CVD, heart attacks, strokes, artery problems. What's the actual risk increase we're talking about?
It's now considered an independent risk factor, meaning even if you control for things like smoking or weight, having periodontitis still raises your risk. The reviews we looked at put the overall increase at about 19% for CVD.
19%. That's not insignificant.
Not at all. And how does it work? Well, a couple of ways. First, that systemic inflammation we just talked about. Those inflammatory molecules, cytokines, circulate and damage the lining of blood vessels, the endothelium. That damage is step one in forming those dangerous artery plaques, atherosclerosis.
Okay, so the inflammation itself damages the pipes, basically.
Right. And second, researchers have actually found some of the specific oral bacteria, like one called Porphyromonas gingivalis, inside those atherosclerotic plaques in arteries.
Wow, the actual bacteria are getting in there.
It suggests they might be playing a direct role in hardening the arteries, not just triggering inflammation from afar.
And you mentioned earlier the risk jumps for older adults.
Significantly, for people 65 and over, that 19% increase in CVD risk associated with periodontitis jumps up to 44%.
44%. That really highlights the long-term damage of chronic inflammation.
It does. It's the cumulative effect over years and decades.
Okay, let's talk about type 2 diabetes. You called this link bidirectional. What does that mean exactly? Which way does it go?
It's a really nasty feedback loop. High blood sugar and diabetes weakens the immune system and increases inflammation generally, making gums more vulnerable to infection. So diabetes makes periodontitis worse.
Okay, so diabetes makes gum disease more likely or severe.
Right. But then the periodontitis itself, that chronic infection and inflammation leaking into the system, makes the diabetes harder to manage. It actually increases insulin resistance.
So the gum disease makes blood sugar control worse.
Exactly. It makes it harder for the body to use its insulin effectively.
The stakes there seem incredibly high for someone managing type 2 diabetes.
They really are. Get this. The data showed that type 2 diabetics with severe periodontitis had a 3.2 times greater risk of dying from heart disease compared to diabetics with only mild or no gum disease.
3.2 times higher mortality risk,
Yeah.
just from the combination.
Yeah. It's a huge warning sign.
It really sounds like treating the gum disease shouldn't just be about saving teeth for these patients. It should be like a standard part of their diabetes management plan. For survival, even.
Absolutely. It needs to be prioritized. And clinical trials back this up. When diabetic patients get proper periodontal therapy, the deep cleaning, scaling, and root planing it actually improves their blood sugar control, their HbA1c levels, for at least 3 months afterwards.
So cleaning up the mouth helps the whole body handle insulin better.
That's the idea. Reducing that inflammatory load coming from the mouth makes a difference systemically.
Okay, moving beyond heart and blood sugar. What about the lungs? Respiratory diseases.
There are definite links there too, especially with bacterial pneumonia. Those oral bacteria, particularly in saliva, can get inhaled, especially in people who are frail, elderly, or have trouble swallowing. That's a major risk for aspiration pneumonia.
Right, inhaling the bacteria from the mouth.
Exactly. And patients with COPD, chronic obstructive pulmonary disease, they also have a much higher rate of periodontitis. It might be a shared inflammatory pathway or maybe just increased susceptibility. But the takeaway is clear. Good oral hygiene can literally reduce the risk of life-threatening pneumonia in vulnerable people.
Okay, chronic kidney disease, CKD. Similar story with inflammation causing damage.
It seems so, and this link is also considered bidirectional and serious. Periodontitis is seen as an independent risk factor for developing CKD in the first place.
Well, really?
Yes. But maybe even more critical is what happens if you already have both. One big study followed patients for 14 years. It found that CKD patients who also had periodontitis had a 35% higher risk of death compared to CKD patients without the gum disease.
35% higher mortality again. It really shows how these chronic inflammatory conditions pile on top of each other.
They compound each other, exactly. It's a lethal combination.
Now, let's touch on two areas that might surprise people the most: cancer and cognition. How can gum disease be linked to cancer?
This is an emerging but concerning area. The connection isn't fully understood, but the chronic inflammation and tissue destruction seem to play a role. One really striking finding was about tongue cancer. The risk was found to increase 5.23 times for every single millimeter of alveolar bone loss due to periodontitis.
5 times the risk per millimeter of bone loss. That's incredibly specific and worrying.
It is. It suggests that the local damage might be contributing to malignant changes. Beyond the tongue, there are also reported associations with cancers like esophageal, stomach, and pancreatic cancer. The research is ongoing, but the pattern is there.
That kind of risk linked to something seemingly small like bone loss really hammers home the need for early detection. Okay, finally, cognition. How on earth is the gum line connected to brain health?
This is really cutting-edge stuff. We're seeing evidence that the inflammation from periodontitis can negatively impact cognitive function, especially in older adults. Mechanistically, some research suggests that the severity of the gum disease, measured by how much attachment has been lost, can actually promote the buildup of amyloid beta plaques in the brain.
Amyloid beta, isn't that the protein linked to Alzheimer's disease?
Exactly. It's one of the key hallmarks of Alzheimer's pathology. The theory is that either the oral bacteria themselves or the inflammatory molecules they release might be able to cross the blood-brain barrier.
Get into the brain itself.
Potentially. And once there, they could trigger inflammation within the brain, what's called neuroinflammation, which in turn encourages these damaging plaques to form.
So meticulous oral care could actually be part of a strategy for protecting long-term brain health.
That's the implication, and it's a powerful one. It really ties everything together. Mouth health is whole body health, including the brain.
Okay, the evidence is just undeniable. The mouth is clearly a critical gateway, a potential source of serious systemic issues. So let's talk defense. What are the absolute core foundational things we need to be doing every day?
Right, the basics are still the most important. The sources consistently point to 4 essential steps for preventing gum disease. Brush effectively, clean between your teeth, floss, or alternatives. Eat a balanced diet, and crucially, get regular professional checkups and cleanings.
Let's break down the mechanical cleaning first. Brushing. How often is really ideal, and what kind of brush matters?
The standard advice is minimum twice a day. But honestly, for optimal plaque control, especially if you're prone to gingivitis, many experts recommend 3 or even 4 times basically after meals and before bed. And the key is using a soft bristled brush. People often think harder cleans better, but soft bristles are perfectly effective at removing plaque and they minimize the risk of irritating or damaging sensitive gums.
Okay, soft brush, maybe more often than twice a day. Now flossing. That stat you mentioned earlier, only 1/3 of Canadians floss regularly. That's wild.
It is disappointing because getting into those spaces between the teeth where plaque loves to hide is just critical. Floss, interdental brushes, water flossers, whatever works for you, but you have to clean those areas.
Here's something interesting from the sources. There was a suggestion that maybe antimicrobial mouth rinses could be as good as, or even better than, flossing for controlling gum inflammation.
Yes, that was a notable point. And it challenges the traditional view a bit. While mechanical cleaning like flossing is great for removing physical debris, these chemical agents work differently. They target the bacteria themselves in those hard-to-reach spots.
So things like chlorhexidine.
Chlorhexidine is sort of the prescription gold standard, yeah. It can reduce plaque by around 55%, gingivitis by maybe 30–45%, huge impact. But even over-the-counter rinses with essential oils or zinc have benefits. And some clinical studies have actually suggested that for controlling gingivitis, the chemical action of these rinses might be equally or even more effective than just relying on floss for those interproximal areas.
So it's not necessarily an excuse to ditch the floss.
Definitely not, but it means these rinses are a really valuable addition to the routine or maybe a more effective primary strategy for people who genuinely struggle with flossing consistently or effectively due to dexterity issues or just compliance. It adds another tool to the toolkit.
That's a really useful perspective. Okay, let's switch gears to diet. Specifically, the sugar and starch connection. How does that actually damage teeth?
It's a pretty straightforward chemical reaction, actually. You've got plaque, which is basically a film of bacteria on your teeth. When you eat sugars or refined starches, those bacteria go nuts. They metabolize those carbs really quickly.
And the byproduct is?
Acid. That's the problem. The bacteria produce acid as they feed on the sugar.
And it's that acid that attacks the tooth enamel. How long does that acid attack last after you eat something sugary?
Surprisingly long, actually. The pH in your mouth drops into the acidic danger zone where enamel starts to soften for a good 5 to 15 minutes after you've finished eating or drinking.
5 to 15 minutes per exposure.
Yeah. So the real danger isn't just what you eat, but how often. Sipping on a sugary drink all afternoon or constantly snacking on starchy things means your teeth are basically bathing in acid for hours. Sticky foods are particularly bad because they hang around longer.
So minimizing the duration of that acid exposure is key. How do we do that? How do we fight back against the acid?
Your body's natural defense is saliva. Saliva is amazing. It has minerals. It has bicarbonate buffers that neutralize the acid and help remineralize the enamel.
So we're going to boost saliva production.
Exactly. The practical tips are limit those sugary, sticky snacks between meals. Chewing sugar-free gum is fantastic, especially gum with xylitol. Xylitol itself seems to inhibit some decay-causing bacteria, and the chewing action massively stimulates saliva flow.
Okay. What about after drinking something like soda or juice?
Definitely rinse your mouth with plain water right afterwards. Even better, if you can, brush your teeth within about 30 minutes. Using a straw for sugary drinks can also help a bit by minimizing direct contact with the teeth. The goal is just to neutralize that acid environment as quickly as possible.
Right, get the TH back up. Okay, so we've covered the mechanical cleaning and the dietary pitfalls. Now let's get into the internal support system. The vitamins and supplements that the research suggests can really help support gum health from the inside out. There are quite a few. Let's start with vitamin C. Seems fundamental for tissue.
Absolutely fundamental. Vitamin C is essential for making collagen, and collagen is the main structural protein in your gums, in the ligaments holding your teeth. It's literally the building block.
So if you're low on C,
Well, severe deficiency is scurvy, obviously, with bleeding gums being a classic sign, but even just having suboptimal levels makes your gums weaker, more prone to inflammation and bleeding. The research clearly links lower vitamin C levels, both in blood tests and dietary intake, to a higher risk and greater severity of periodontal disease.
and taking extra vitamin C can actually help if you already have gingivitis.
Yes, studies suggest supplementation can help reduce gum bleeding in people with gingivitis, likely by strengthening that collagen structure and supporting healing.
Okay, next up, omega-3 fatty acids, DHA and EPA. These are famous for being anti-inflammatory, right?
They are, and they work really well in the mouth, too. It's not just about reducing inflammation. Omega-3s are actually involved in the resolution of inflammation. They help actively switch off the inflammatory process and promote tissue repair.
So they're not just dampening the fire, they're helping clean up afterwards.
That's a great way to put it. And the clinical results are pretty impressive. A big review from 2020 found that people taking omega-3 supplements had significant improvements in key periodontal measures. Things like probing depth, meaning the pockets around the teeth got shallower and less plaque, especially when they combine the supplements with professional dental cleaning.
Interesting. Any idea how they work beyond just general anti-inflammation?
One specific mechanism mentioned was that they boost an important antioxidant enzyme in the gums called superoxide dismutase. So they help the gum tissues fight off damage from oxidative stress caused by the chronic infection.
Okay, that leads not only to thinking about the environment within the mouth, the microbiome. This is where probiotics come in, right? It seems a bit weird, fighting bacteria with more bacteria.
It does sound counterintuitive at first, but think of periodontal disease as an imbalance, a dysbiosis where harmful bacteria have taken over. Probiotics are specific strains of beneficial bacteria. The idea is to introduce these good guys that have known antimicrobial or anti-inflammatory properties. They can compete with the harmful bacteria for space and resources, sometimes produce substances that inhibit the bad guys, and help nudge the whole ecosystem back towards a healthier balance.
Now, you might be wondering, is there a way to give my oral microbiome an extra boost and really support this whole process? And that's what I get asked about probiotics. A lot of you know I always focus on evidence-based products, and one that has caught my attention is Prodentim. It's a probiotic blend specifically designed with strains that target the health of your mouth and gums, working from the inside out to support a healthy balance of good bacteria. If you're looking to take your routine to the next level, you can learn more about it. I've left a link for you in the description below so you can check it out for yourself and see if it's right for you.
And digging back into the science on this, the research using specific strains is really encouraging. There was one study using lozenges with Lactobacillus reuteri. People with periodontitis who used these lozenges had significantly bigger reductions in certain key bad bacteria compared to just getting cleaning alone. especially one called Porphyromonas gingivalis.
Porphyromonas gingivalis, we mentioned that one earlier in the context of heart disease, right?
Right.
Why is it such a target?
Yeah, P. gingivalis is what scientists call a keystone pathogen. It's particularly nasty. It doesn't just cause inflammation, it actually messes with your own immune response in the gums and disrupts the whole microbial community, making it easier for other harmful bacteria to flourish. So knocking down its numbers is really important for managing periodontitis.
So the probiotics are like sending in reinforcements to fight off these keystone bad guys.
Pretty much. And while some studies use lozenges for direct delivery in the mouth, the reviews suggest that general probiotic supplements, like capsules, are also likely beneficial. They can help influence the microbiome throughout the upper digestive tract, which includes the mouth and gums, contributing to overall balance.
Okay, moving on. Vitamin D. We usually think bones, but it's key for immunity too.
Absolutely critical for immune function, and it plays a direct role in keeping gum tissue healthy and controlling inflammation. Since vitamin D deficiency is so widespread globally, its link to periodontitis is a big deal. Studies consistently find people with gum disease tend to have lower vitamin D levels. Correcting that deficiency could be an important part of the puzzle.
Makes sense. Next, zinc. We hear about it for colds, but it's crucial for gums too.
Very crucial. Zinc is needed for tons of enzymes in the body, including those involved in making collagen, and really importantly, wound healing. If you're low on zinc, wounds heal slower and you're more susceptible to infections, including in the mouth.
And does applying it topically help, like in toothpaste?
Yes, it seems to. Zinc-containing gels and toothpaste have been shown in studies to help reduce plaque buildup and improve overall gum health when used regularly.
And didn't you mention it has another interesting role related to the mouth?
Yeah, a little side note, zinc is also essential for your taste buds to function properly, so a deficiency can impact not just gum healing, but even how you perceive taste.
Huh, interesting. Okay, let's quickly cover the B vitamins. Are they important too?
Yep, several of them. Low levels of folate, B9 and thiamine B1, for instance, are linked to higher rates of periodontal disease and gum bleeding. And B12 deficiency has been associated with gum problems, sometimes even showing up in children. So getting enough of the whole B complex supports overall metabolic health and tissue repair, which includes your gums.
All right, to our antioxidants. Coenzyme Q10 or CoQ10, what's its role?
CoQ10 is a powerful antioxidant found in basically every cell, vital for energy production. It seems to have protective and anti-inflammatory effects in the gums. Clinically, studies where people with periodontitis took CoQ10 supplements, around 120 milligrams a day, along with their dental treatments, showed better reduction in gum inflammation compared to just the treatment alone.
And can you use it topically too, like zinc?
Yes, CoQ10 gels applied directly to the gums have also been shown to boost antioxidant enzyme levels right there in the tissue.
Okay, interesting. Now for a botanical. Curcumin from turmeric. Huge buzz around this for inflammation. Does it help gums?
It looks very promising. Curcumin has well-known anti-inflammatory and antioxidant effects, but specifically for oral health, it's also shown antibacterial activity, including against that key pathogen, P. gingivalis.
Ah, it inhibits the keystone pathogen again.
Exactly. And studies using relatively modest daily supplements, like 80 milligrams, have shown it can help reduce gum inflammation and bleeding.
And finally, green tea. Is just drinking it daily helpful?
The evidence suggests it could be a good complementary approach. Green tea is rich in catechins, which are antioxidants that can reduce inflammation and slow the growth of various oral bacteria. So yeah, studies indicate that either drinking it regularly or using products containing green tea extract like special gums, gels, or mouthwashes might help reduce plaque and gum bleeding. Probably not a primary treatment on its own, but a simple, low-risk addition to your routine.
Okay, that's a comprehensive look at prevention and support. But what about situations where basic oral care itself becomes a major challenge? Our sources highlighted some really tough scenarios. Let's start with dry mouth xerostomia. How common is this?
It's incredibly common, especially in older adults. Maybe up to 60% are affected. And it's really damaging because saliva is so protective. Without enough saliva, decay and infections can just take off.
What's the main cause? Is it just aging?
Not just aging itself, usually. The overwhelming primary cause is medication side effects. Over 400 common drugs can reduce saliva flow.
400, like what kinds of drugs?
Things like many antidepressants, antihistamines, for allergies and colds, lots of blood pressure meds, certain pain relievers. Also, radiation therapy to the head or neck, smoking, and conditions like diabetes, Parkinson's, and Sjogren's syndrome can cause it too.
So if saliva is the mouth's natural protector, what are the warning signs when it's not flowing well?
You'd look for a tongue that looks dry, maybe cracked, or even swollen. People often report changes in how things taste. They might find it genuinely difficult to chew, swallow food that's dysphagia, or even talk clearly. And dentists will often see a sudden increase in cavities, sometimes all over the mouth. Oh, and people might complain their lips feel like they're sticking to their teeth.
Okay, so what can people do about it? How do you manage dry mouth?
Constant hydration is key. Frequent small sips of water, sucking on ice chips. Chewing sugar-free gum, especially with xylitol, is great for stimulating whatever saliva flow is left. There are also over-the-counter saliva substitute sprays, gels, rinses that can provide temporary relief. Using a humidifier at night can help too. And absolutely meticulous daily brushing and fluoride use is crucial to fight off the increased decay risk.
And just as important, what should people with dry mouth avoid?
Right. Definitely avoid alcohol-based mouth rinses. Alcohol dries things out further. Avoid caffeine and very sugary, sticky foods. Spicy or acidic foods can also be really irritating. And a big one, especially in care settings, avoid those lemon glycerin swabs. They used to be common, but the citric acid actually makes dryness worse in the long run and can erode enamel. Stick to water or saliva substitutes for moisture.
Good to know. Okay, let's move to another challenging situation. Providing oral care for someone with cognitive impairment, like dementia. The sources mentioned a framework, the 7 A's.
Yes, the 7 A's framework is really helpful for caregivers to understand why oral care can become so difficult. It describes the different losses the person is experiencing.
Can we unpack maybe 2 or 3 of those A's to see how they impact care? Let's start with anosognosia.
Anosognosia. It means the person has no awareness or knowledge of their illness or its effects, so they genuinely don't understand why you're trying to brush their teeth. They might have forgotten what a toothbrush is for, or that they even need daily hygiene. This lack of insight often leads to resistance, confusion, even fear or anger during care.
Okay, so they don't realize they need help. What about the physical act of brushing? There was apraxia.
Apraxia. This is the loss of purposeful movement. The person might still be able to physically hold the brush, they might even recognize it, but they can't figure out the sequence of actions needed to actually brush their teeth, pick it up, put paste on, lift it to the mouth, make the right motions. The brain's motor plan for that specific task is lost or scrambled.
So it's not weakness, it's a planning problem.
Exactly. It's a huge barrier to doing the task independently. And then there's apathy.
Apathy, loss of motivation.
Right. Loss of initiation. They might theoretically be able to do it, they might understand, but they just lack the internal drive to start or continue the task. The caregiver has to provide all the motivation and prompting.
Understanding those losses makes the challenges much clearer. So what are the key practical tips for caregivers facing this?
Routine is everything. Same time, same place each day if possible. Always approach calmly from the front. Identify yourself. State the task simply, time to brush your teeth. Use visual cues. Show them the toothbrush and paste. Keep the atmosphere calm and positive. Lots of reassurance. And crucially, encourage participation, even if it's minimal. For apraxia or apathy, you might need to start the motion for them. Put the brush in their hand, maybe guide their hand towards their mouth, do the first couple of strokes, and then see if they can take over even a little bit. That hand-under-hand guiding can be really helpful. Patience and positivity are key.
That makes sense. Okay, another high-risk group. People with swallowing disorders, dysphagia. You mentioned the big risk here is aspiration pneumonia.
Yes, that's the critical danger. If someone has dysphagia, liquids, food, or even just their own saliva, which, as we know, can be full of bacteria, can accidentally go down the wrong pipe into the trachea and lungs, that's aspiration.
And if bacteria get into the lungs,
You get aspiration pneumonia, which can be devastating, especially for frail individuals. So the logic is simple. The cleaner the mouth, the fewer harmful bacteria in the saliva. If aspiration happens, the less likely it is to cause a serious infection.
so oral hygiene basically becomes a medical necessity to prevent pneumonia.
Absolutely. It's a core part of safe care for anyone with dysphagia. If they have natural teeth, they need to be brushed thoroughly before and after every single meal, and critically, right before bed.
Why is before bed so important?
Because saliva production naturally drops way down when we sleep. This allows bacteria in the mouth to multiply like crazy overnight. If someone aspirates saliva while sleeping, which is common, you want the bacterial load going into their lungs to be as low as possible. Cleaning right before sleep is probably the single most important time.
That's a really vital point. What about dentures?
Same principle. Dentures need to come out, be cleaned thoroughly with a brush and appropriate cleaner, and the person's gums and mouth tissues underneath also need to be gently brushed or wiped clean before bed.
Now, what about those foam swabs? They seem common in hospitals and care homes for mouth care. The sources had a strong warning about them.
A very strong warning, and it's important. Those foam swabs, sometimes called toothette swabs, are just not adequate for cleaning teeth. They don't have the mechanical action needed to actually scrape off the sticky plaque biofilm. They might wet the mouth, but they don't clean it.
So they give a false sense of cleaning.
Exactly. And worse, for someone with dysphagia, there's a real risk the foam tip could actually break off and become a choking hazard. The standard really has to be a soft bristled toothbrush and fluoride toothpaste whenever possible, even if it's challenging.
Okay, noted. Finally, let's quickly cover the basics of denture care for people who wear them. How should they be cleaned?
Dentures build up plaque and tartar too, just like real teeth.
Hmm.
So they need daily cleaning. Use a proper denture brush. They have bristles designed for the shape and a non-abrasive cleaner. Liquid hand soap or a dedicated denture foam cleaner works well.
What should people absolutely not use?
Definitely avoid regular toothpaste. It's too abrasive and will scratch the denture acrylic. Also avoid harsh household cleaners or strong bleach solutions unless it's a product specifically designed for denture soaking. Scratches just create more places for bacteria to hide.
And should dentures be worn 24/7?
No, definitely not. The gums underneath need a rest. Ideally, dentures should come out overnight. If that's not possible, then at least for a couple of hours during the day. This lets the tissues recover, improves blood circulation, and helps prevent fungal infections like denture stomatitis, that inflammation with little red spots you sometimes see under a top denture.
Makes sense. And one last practical tip, especially for care homes: labeling dentures.
Oh, absolutely crucial. Dentures are custom made and expensive. Losing them is a huge problem for eating, speaking, confidence. Labeling is vital to prevent mix-ups. Ideally, a dentist can embed an identifier, but a DIY method works too. Gently roughen a small, non-visible spot on the denture with an emery board. Write the name clearly with a permanent marker, and then seal it with a couple of layers of clear acrylic nail polish. It can save a lot of trouble.
Great practical advice. Okay, we covered a huge amount of ground. Let's try to synthesize the key takeaways from this deep dive.
I think the absolute core message, the thread running through everything, is that your oral health and your systemic health are just fundamentally linked. They're not separate things. We saw clear, quantifiable risks from untreated periodontal disease impacting cardiovascular health, making diabetes much harder to control and more lethal, contributing to kidney disease mortality, and even having links to cognitive decline in certain cancers.
And the foundation for protecting yourself is still that mechanical cleaning, brushing, cleaning between teeth, plus professional care and watching the sugar.
Absolutely, that's non-negotiable. But what the research also strongly suggests is that we can bolster that foundation from the inside.
Right, the nutritional support, making sure you have enough vitamin C for tissue structure, using things like omega-3s to actively fight inflammation, maybe even using probiotics to help balance the oral microbiome.
Exactly. These are evidence-based ways to complement your daily routine. They provide extra support.
But it's crucial to remember, as you said, they complement, they don't replace. You still have to do the daily brushing and cleaning and see your dentist or hygienist regularly.
Precisely. The supplements are boosters, not magic bullets.
And finally, for my viewers who are ready to be proactive about supporting their oral microbiome, the team at Prodentim has an offer for you. They are so confident you'll love it that it's backed by a 60-day money-back guarantee. If you want to try it, head to the link in the description to see if it makes a difference for you. Remember, it's not a replacement for brushing and flossing. It's about giving your body that extra support it needs.
So as we wrap up this really detailed exploration, maybe here's a final thought to leave everyone with, something provocative to consider. Given how strong these connections are, these bidirectional links between gum disease and huge public health issues like type 2 diabetes and heart disease, what would happen if we truly integrated oral health screening and prevention into routine care for those chronic conditions? How might that shift things globally? Could making comprehensive oral health a standard part of managing diabetes or heart health actually move the needle away from just treating illness and towards genuine large-scale prevention of some of our biggest killers? Makes you think, doesn't it?